We're hanging in the studio today, shining our local voices spotlight on someone most of you have heard a lot about by the many patients whose lives have been transformed through his expert care. It's Dr. Kamran Gaddarzi, as in nice legs, Dr. Kamran, from DermOne Scarless Vein Care. So glad to have you in. Thanks for joining us.
Thank you very much for having me.
First of all, will you just tell us a little bit about your background?
Okay. Well, I hope I'm not going to take too much of your time to take you back to my background. But first of all, it's an honor to be here. I certainly listen to your station, and it's very nice to be able to have a radio station which particularly shines some light on our local market and expertise in our area. And going back a little bit, went to boarding school in England. I was raised in England, and I went to University of London Medical School, and had another 18 months to get my boards in surgery when we decided to move to United States. I got married and came to United States. I started my residency back again in general surgery. So I did another 5 years of residency here in the United States. Got my fellowship of American College of Surgery. I've been practicing as a general and general vascular surgeon for quite a while. I've been in this area since 1985, so it's quite a few years.
And what led you to focus on vascular issues?
When vein centers started, we started it became a super specialty. We started with vascular surgery. Then vascular usually means arteries. People usually ignore veins. I used to think veins was just cosmetic. And then as you start doing more and more vein procedures and you do a more thorough job, you find that a lot of these people really get a lot better. It improves the quality of life. I was always fascinated with vascular surgery, and when I was going through my training, people didn't realize that smoking was bad for you.
Right.
Cholesterol, there wasn't much treatment. You ate what you wanted. So it was very prevalent. So you couldn't be a surgeon and not have to deal with vascular surgery. When you're on call in the emergency room, somebody comes in with a cold foot. If you don't get in there, do something within 6 hours, they're going to lose their leg. By the time you realize you got a problem and they come to the hospital, you sit in the emergency room for a few hours, then you show up to see the patient and you realize it's already been 4 hours and they're about to lose their leg. So you just have to run in the operating room. You can't just say, let's see if I can find somebody else to do the procedure. So the same thing with ruptured aneurysms. You've really got minutes to save that patient's life. So, but it is very rewarding because it literally, you know that you saved that patient's life. When somebody comes in with a carotid artery disease, I remember a gentleman who was 50 years old and he was an electrician on top of a pole and just got some weakness in his arm and basically had a mini stroke, fell on the floor. They rushed him to Cape Fear Hospital. At the time, he would have never been able to function. His speech center was disappearing. So we just rushed him right to the operating room and cleaned up his carotid artery, and thank God he totally recovered. So there's nothing more rewarding to get him back to function. It's very rewarding. And I think anybody who's been in medicine or even in nursing or anything to do with medicine, we go into this field because we enjoy, helping people. We enjoy to see that we made a change. Just the very fact to let somebody live another year and to be able to function, to be able to walk, trust me, there's nothing in the world which can replace that. There's not a single penny in the world. There's nothing more satisfying than to be able to do that. And I think anybody goes into medicine, it does that for that reason. And the satisfaction you get out of that is unbeatable.
We're in the studio today with Dr. Kamran from DermOne Scarless Vein Care, learning a little bit more about him and how he and his team help folks with vascular issues that really affect so many more of us than you might think. We're going to learn more about some of those symptoms when we get back, right after this. Again, we're in studio with Dr. Kamran of DermOne Scarless Vein Care. If you're just joining us, we're picking up where we left off in our interview with Dr. Kamran of DermOne Scarless Vein Care. You can check them out online while we're chatting this morning at DermOneScarlessVeinCare.com. We've been learning more about Dr. Kamran's work and how he's helped so many in our region with his state-of-the-art treatment for vascular issues, whether it's spider veins, varicose veins, and a lot more. So, Dr. Kamran, tell us about some of those symptoms that are major flags that folks have issues with beyond simply the cosmetic visual effects.
For example, night cramps. A lot of our patients wake up in the middle of the night, have to literally get up and walk till the pain goes away to go to sleep. To get a good night's rest is very important. I think every human being deserves to get a good night's rest. Now, most of us, when you get a little cramp, it might wake us up, it might not. If it does, you just move your foot a few times and you go back to sleep. But some of these patients is so bad, they have to literally get out of bed and walk. I mean, think about that. We're just about to publish our result. It's about 90% improvement in restless leg after they're having their veins treated. Now, I'm not saying everybody with restless leg has got venous disease, but if you have restless leg syndrome and you have veins, which are disease, which are, venous insufficiency, you treat those patients. We are about to publish our result. 90% of these patients after we did their veins got better. I have one gentleman who's been on medication for almost 20 years for restless leg syndrome because there is no real cure for restless leg. They usually put you on medication. Any medicine long-term can damage your liver, can damage your kidney. To be able to do a procedure, which it is really just takes maybe 20 minutes, half an hour to do it, to get them off the medication, I mean, that is rewarding. I had one lady who came in to see me. My God, she said, my husband usually makes my bed, which I was very envious because I never make my bed. My poor wife has to do it. But she said that, he said, I didn't have to touch your bed. Usually the sheets, the blanket is everywhere because you wiggle all night. Couples are always nice to each other. So like my wife always tells me I never snore. I swear I must. But she says you don't snore because she doesn't have the heart to tell me. She's worried about my feelings. You don't ever tell your partner, honey, you're running the marathon every night. I can't sleep because of your doing all these movements. But when it's gone, like, honey, I'm so glad you had your veins done because you used to run the marathon every night. I had one of my patients told me my wife is now allowing me to sleep in bed with her every night. I said, what do you used to do? He said, I used to sleep in the couch for like 5-6 years. So to be able to do something relatively so small and achieve such a result is very rewarding. I often tell my colleagues, I say, I've never done so little and achieved so much.
But it's got to take an entire specially trained team to have such successful outcomes, right?
It is a team. Any other kind of surgery, you can go in the operating room, they give you a pair of gloves and a gown. You can do a very good job. If you're going to do vein surgery, it is on an outpatient basis. You really need to have a great team. You have to be able to make a good diagnosis. You need vascular ultrasound techs who are certified in vascular ultrasonography to make the right diagnosis. Because as one of my professors said, it's not the treatment, it's the diagnosis. So we have an amazing team.
And as I understand, DermOne Scarless Vein Care was the very first vein center in the state of North Carolina to receive accreditation. That is a huge testament to your talented team. Can you shed a little light on what exactly accreditation means?
About 2 years ago, they decided to create a vein center accreditation. Like if a hospital is accredited, that means it has to meet the highest standards they can. So I'm so proud of my practice. I said, we should apply for accreditation. And we were one of the first 20 centers in the whole nation who got accreditation. So it was a great honor. Of course, it requires very stringent requirement. You have to have all of your ultrasound techs have to be vascular ultrasound tech. You have to make sure you're meeting very strict criteria to be able to get your accreditation. So I'm very honored. I think patients need to know where they're going because I honestly think if you're serious about veins, you need to do it right or don't do it at all. Roughly about 50% of cases I do are redos. There are patients who've been operated on elsewhere and they didn't have good results. They've come to see me. Now, I don't mind doing redos, which are always much more complicated and takes a lot more time to do. But I just wish they came to see me first or go to a center where they can do it well the first time so you don't have a second procedure. So if you ask me, Dr. Kamran, name one thing which is most important for a patient to go to, I would say make sure it's an accredited vein center because that by itself also brings you a vascular surgeon or a general surgeon with vascular interest or somebody who's got their fellowship or has passed an exam. I'm board certified from American College of Phlebology about 10 years ago to do just a vein as a specialty. It's a super specialty. You have to have that in order to get accredited. So it's not only for the center itself, it's also for the doctors, for the nurses, for the people who work there that you have met certain criteria.
We're in the studio today with Dr. Kamran from DermOne Scarless Vein Care, learning a little bit more about his work. When we get back, we'll talk about some of your neighbors whose lives have been transformed through his state-of-the-art expert care. Visit scarlessveincare.com in the meantime to learn more. If you're just joining us, we're picking up where we left off in our interview with Dr. Kamran of DermOne Scarless Vein Care. You can check them out online while we're chatting this morning at scarlessveincare.com. Now, Dr. Kamran, I've personally spoken with some of your patients when they come in to record their stories for some of your ads, and it's always incredibly moving. In fact, I've even been moved to tears when I see how your expert care has made such a difference in their lives. Are there any stories that stand out to you that you'd like to share with us today?
I think every story is very important, and you go to bed at night just thinking about some of the success stories you might have heard, and that's what gives us energy to get up the next morning and come back to work. A lot of people tell me, how do you work so hard and so many hours, and I don't take any break. And honestly, the energy I get from seeing the satisfaction from my patients is the main thing. Of all the stories, they're numerous, and as I'm talking, I thought the one story which just stands out the most is when I first started doing vein procedures, which was around 2002, and this lady that came to see me, she actually did one of our radio ads. Beautiful girl. She had these horrible scars on her legs, and she said when she was 15, she had to give up cheerleading because her veins on her leg looked so bad. She went to see a surgeon who did vein stripping, which is, I think, should be considered medieval in a way. So they made these 1-inch incisions on the way up and down her leg. And I'm trying to think, you're 15, 16 years old. You're a beautiful, healthy, great physique because you do cheerleading. So, beautiful legs. And somebody comes and maims your leg like that. And now you have to quit cheerleading and you have to cover your leg for the rest of your life. And the sad part is, even when they did vein stripping, 40% of them came back. So she's about 24, 25 when she came to see me. And I was able to go ahead and close those veins using laser with no scar. And she was just absolutely amazed. But it was also painful. It was bittersweet because she realized this could have been done without any scar. She wouldn't have had to give up her cheerleading, and she wouldn't have had this scar. A lot of the pain and suffering that she went through emotionally. I think most guys, we're very stupid. We don't always get it. You don't know. I've had 70, 80-year-old patients who come and tell me that they never showed their legs on the beach since they were like 25 years old, never went to the beach nor swimming pool because they didn't want anybody to look at those ugly veins on their legs. So there's no reason, whether it's for looks, whether it's for function, that you should not have yourself treated. I had a patient who came to see me. She's actually a nurse. And she said, I went to see Dr. So-and-so, and they did my veins. And I couldn't tell the difference. So I went back. They did an ultrasound. They said, everything looks like the way it's supposed to. But I don't feel any difference. So I was going to go back. And then my other leg done, they asked me to go back. But I'm not going to because I couldn't tell any difference. So that's why I come to see you. And I did an ultrasound in the office. I found out that the vein that they were treated was only like 1/3 or 1/4 of it was treated. The other was open. Of course, I showed it to her, and we were not, we're going to go ahead and take care of her. So that actually gives the procedure also a bad name, because if she didn't know me and didn't come to see me to point out what exactly happened, she would think that, don't have your veins done because it doesn't work. Right. I had mine done. It doesn't work. I still have to wear my stockings in this hot weather. By the way, stockings do work. It does make them better, which in Wilmington, I don't think many people can wear pantyhose or thigh highs in the middle of summer in Wilmington, North Carolina. And they look a little silly on the beach with pantyhose on. So my recommendation is, the stockings are good, but there is an alternative. If you have your veins taken care of, then obviously you can hopefully come off your stockings.
Thank you so much again for taking the time to join us here in the Penguin Studio. For those of you out there listening, you can call 798-LEGS to arrange a free vein health screening, and visit scarlessveincare.com if you want to learn more about Dr. Kamran's work and the many people from all walks of life and all ages who he's helped, with symptoms ranging from those unsightly varicose and spider veins to tired, achy, restless legs.
Well, thank you very much. And it's nice to be able to have a station like yours to listen to real people, and appreciate having the opportunity to come and talk with you and meet you in person.
Nice legs, Dr. Kamran.
Thank you.